Good morning, everyone. Good morning.
Good morning.
I'm going to tell you a little bit about what's going on in Kaiser. I don't have all of the answers. I don't even have all of the questions. I'm very much interested in hearing from you and getting your thoughts. And I'll throw a few things out that are going on in my world, and I'll give you a sense of the disruption that I'm encountering and creating in some cases. And plenty of opportunity, as Mr. Churchill would say. This little graphic up here on the left side of the chart, it really is another depiction of the affordability crisis that our healthcare industry has been creating. As you can see, for the last 15 years, going back to about 2000, there's been, roughly 40% general inflation, a little more of that, slightly more than that, and wage creation, and yet the cost of healthcare has gone up 182% in that same period of time. Obviously, that's not sustainable. There are many forces that are going to reacting to that. Certainly the market forces, social forces, and then ultimately political forces. So when you think about, okay, so what happens as a result of that? On the right side of the chart is kind of the mix of our membership, if you will, within Kaiser Permanente. We're on the road to about 10 million members in Kaiser, so it's a big chunk of population, and in terms of health management and all those kinds of things, it's a huge opportunity. As you can see on 2013, just last year, over 50% of our membership were coming through corporate accounts. And that has been the bread and butter of Kaiser for a long time, and today continues to be. But as you can see, in just a very short period of time out to 2020, there's a big muscle movement that's going on where those kind of relationships are pretty much legacy, and now all of the increase in membership that we're going to experience going forward is going to be individual, Medicare, somebody coming through some type of exchange. In other words, the era of consumerism that Mr. Hinton alluded to very eloquently earlier is upon us. And we have to completely think differently about how to address the member of today and in the future than we have in the past. In our response to this, our CEO, Mr. Bernard Tyson, has put a strategic framework out there, perform, grow, and lead. This is kind of our strategy going forward for Kaiser. Perform, to continue to work the affordability issues, continue to focus on high quality healthcare delivery at an affordable cost. Grow, it's absolutely, with these new people coming into having coverage, how do we embrace those people? In some cases, they're coming in with a revenue stream that's actually less than their cost of care today. We have to find ways to bend cost curves to make that sustainable. And then lead. Our system has a responsibility to be out there and trying things and trying to push the industry a little bit. We have the scale to do that, and we're trying to leverage that scale and be relevant going forward. From the facilities side, which is on the right side, it's really about linking up to this. I have to be a two-trick pony right now. One trick is to deliver on a huge program. We have a multi-billion-dollar program that we have to deliver on every year, and believe me, that's a day job. That's a full-time job right there. Oh, but by the way, the other trick I have is I have to completely reinvent myself along the way. And that's pretty darn hard. So we're focused on that. In fact, my organization has two goals: build trust through performance and create value through innovation. So we're really trying to have that balance, if you will. And I don't mean one in lieu of the other. I mean both and, so it makes it pretty darn challenging in what we're doing. Some of the things that we're doing is looking for, first of all, coming to terms with the fact that we don't have the answers. We must embrace the greater community in the country, in fact, and how to deliver health care in new and better ways. And so we're working from a facilities point of view to really try to network with industry and find those breakthrough kinds of opportunities at the earliest time so we can start to inject those into the way we do business. So, you know, we've had design competitions. We're reimagining ambulatory design. You know, we have a think tank literally of people that are, you know, with physicians and administrators and other clinical operators sequestered, really working these kinds of issues, coming out with new and better ways, more efficient and high quality ways to deliver care across the full spectrum, from whether it be a very acute inpatient environment all the way through literally home care while you're on your smartphone and getting health care in that respect. Some of the things that I'm showing on this slide are things that we're heavily embroiled in now under an initiative we call KPFM 2015, Facilities Management 2015. I invite your attention to a couple of them. Design excellence, that's what we're shooting for. It's no longer, you know, here's the Kaiser box. We want our designers to design the box and regurgitate it back to us. We very much are interested in really challenging the industry to give us innovation in ways that we haven't thought of or dreamed of. And you know, the challenge is we have to be receptive to that when it comes along and say we're ready to take the risk, we're ready to do these kinds of things. And you know, the capital approval process and isn't necessarily spring-loaded to embrace risk. So you know, it's a big challenge. You know, we're really focused on three levers that we're pulling here. You know, people, process, and technology. Across those three, you know, broad areas, really elevating people, reinvesting people to get out of transactional mode and get into much more, you know, of a senior management and strategic mode in the business, and leverage all the great industry partners out there to do more of the day-to-day transactional part of the business. You know, on the process, it's all about leaning. It's all about finding better ways to deliver. It's about faster, better, cheaper. Faster, better, cheaper. Okay, that's the mantra, faster, better, cheaper. And then on technology, of course, the technologies are there. We're moving off of legacy facilities. You know, with the scale of Kaiser, it's hard to do that because it's huge investments to go to, you know, the latest technologies and business applications and so forth. We just made a commitment to go to eBuilder, which will be the foundational business application for our capital execution. And it's a big muscle movement and change management challenge to get in, you know, the entire system into that new world order. You know, the outreach with industry is very overt and continual. You know, we have a continual series of symposia with designers and general contractors. The folks that cut across the industry that work with all the hospital systems and health systems and say, bring us all the great ideas that somebody else thought of, you know. Come give those to us. So, you know, we're not bashful about asking for, you know, copying bright spots that have been uncovered by the industry. We've been working with the American Institute of Architects and really trying to focus on building communities around healthcare design in ways that we haven't seen in the past. So, you know, it's pretty exciting. Lots of good work going on, and I think we're getting the results we're shooting for, but much, much, much more to come. You know, here's a couple of examples of facilities that we literally have in flight right now. In fact, the one in the middle is a large medical office in Antelope Valley near Lancaster, California, which, you know, is about as un-Kaiser-like a building as you could possibly imagine. You know, this thing is LEED Platinum, net zero in terms of sustainability, incredible reaction to, you know, the environment and so forth. A lot of the concepts of that came out of our small hospital big idea competition that we had a couple of years ago, and we've rolled those into that. In the corner there is a new hospital, about a 350-bed hospital that we have in construction right now in San Diego. Again, I think this might approach LEED Platinum. It's definitely going to be LEED Gold for healthcare. And you know, this is, again, a case of where we looked at all the concepts that came in and try to harvest as many of the good ideas and roll them right in to the facility that we're designing as we go. So this is literally on the fly. You know, the technology in this building, the patient experience in this building will be a light year different from a traditional Kaiser hospital. And we're just so excited about it. You know, we have mock-ups of all the rooms now, and when we bring our senior leadership through, it's really wow moments when they see the interactive experience that the patient and the family has with their caregivers. So, you know, this is kind of the sort of our juice right now that we have. It's about innovation, innovation. We got to keep the delivery going. You know, the tough part of all of this, of course, is we have this lumbering process in this world of disruption and change. I mean, it's almost a total disconnect. I mean, to do a major hospital like that San Diego hospital, traditionally with the regulatory environment in California, you're talking about a decade project. You know, what is healthcare going to be 10 years from now? Who knows, all right? And so trying to design and build this, always anticipating the next technology and innovation has been really kind of interesting. We literally are holding off making, you know, key design decisions to the absolute last point, you know, in the critical path of delivery of this facility, so we can get the latest technologies and continue to raise the bar in terms of performance of this really important facility. So it's just, it's a very exciting time for us. We have lots of things in motion. And boy, am I interested in hearing your thoughts and suggestions about how we could work better with you to continue to be relevant and raise the bar in our industry related to healthcare facilities. So with that, I'll turn it back to you, Scott.
Well, no, so the thought, you know, we have some time here. The thought is that kind of have a bit of a conversation about this. And so as I get to your questions, the one thing that you know, struck me, Don, was there are a number of folks in the room whose systems are rapidly growing. Kaiser has been a system for a long time, and a lot of folks are dealing with the centralization versus decentralization conversation, right? So centralized for efficiency, centralized to standardize, command and control kind of thing. I think Kaiser's viewed as a highly centralized organization, but I know in your day-to-day, your partners in the regions, you know, are looking to drive business on a more decentralized basis. How do you deal with and reconcile that? And I'm going to wander the crowd and see who's got questions. Okay.
Well, Kaiser's anything but highly. In some respects, is this thought? Yeah. In some respects, you know, we strive to try to have standard processes and set the bar based on evidence-based design and the care delivery model, you know, being evidence-based and so forth. But it's very much a mosaic of bright spots, and we're continuing to try to, you know, capture breakthrough and innovation and try to spread it. But it's a slow, painful process that, you know, our company kind of grew up as fiercely independent regional business units, and now we're trying to sort of weave them back together. And of course, we want to avoid the, you know, the overcorrection of going too highly centralized and stifling innovation and so forth. So we're trying to hit some kind of a balance. The same thing goes for me in the facilities management business. I have lots of people forward deployed at all of our operational regions and so forth, and they have, you know, they have a certain amount of pride of ownership and autonomy. But now we're trying to move into these enterprise systems and approaches to the business. So hopefully it's a balance and a win-win. It's not one of these either or, it's a both-and scenario. And we're in the middle of it right now. I'll let you know how it turns out.
Does anybody have a question about any, or kind of a, yeah, sure. Well, that's so everyone else can hear.
Question, so when you started building LEED Silver or LEED Gold as your standard, and now you're hitting Platinum, have you guys had a chance to recognize or capture data based on clinical outcomes for the different levels of LEED, or even just overall sustainability in the facilities, and also the impact of employee or caregiver retention?
Yeah, great question. You know, we very much are interested in how all of this impacts health outcomes. Obviously, that's the gold standard that we're all shooting for. You know, right now the connection is somewhat loose, to be honest with you, and we're looking to get involved with any kind of research that's going on out there in this area that could really track and attribute outcomes to that. So if anybody is, you know, got a long suit in this and looking for some partner to engage in, you know, let me know. I'll be happy to jump in. You know, what we're seeing is Clearly, though, the patient experience is incredibly improved. The ability for families to be part of the, in an acute environment, to be part of the care team is critical, et cetera. And we believe that we are being successful within Kaiser with this integrated model to actually improve health outcomes. I mean, it's amazing statistics of where Kaiser members statistically are much healthier than the background population, especially in California, where we have some really good data to support that. So we think we're on that journey, but in terms of having hard research, it's tough. But if anybody out here is doing that and you want somebody to partner with, let me know, because I think there's a real opportunity here.
Last time I saw your kind of scorecard for facilities,
right.
You had, I recall there were kind of 5 measures of cost on one side and 5 measures of quality on the other, and you wanted to be driving down facility cost per member, space per member, that kind of thing, and then you wanted to be able to drive up experience and outcomes, and you were looking for what those quantitative metrics were so you could report success.
Yeah, I think we can get business metrics without too much problem, membership, retention, all those kinds of things I think you can measure pretty well. In terms of real health outcomes, how did the facility impact the outcome of the health of that member? Gosh, that's a hard one. There's so many variables in there. As was alluded to earlier, it's really not about the facility. That's a big chunk of it, but it's more about the staff. It's more about the attitudes. It's more about, the whole system of care. So, how does facilities run and stay up at the big boy table and be in this conversation? It's hard, but, it's easy to get into the order taker mode. And it's much more challenging to elbow your way into the strategic planning of what's really going down in the system. And so we're trying to be relevant, but you can't show up at the door and knock and be empty-handed. You got to have beer and Doritos or something. So so we're saying we got data, we got outcomes, we want to talk about stuff, and come on in, have a cup of coffee.
I have a question over
Yes, sir.
Hi, Clint Russell with Design and Construction Department at HCA in Nashville, Tennessee.
Hi.
Hi. So you mentioned that you've really, I guess, tasked your architects or design teams to kind of get out of the box and bring you innovation. We've had our own building capital program for the last 3 years or so where we're trying to change how we source things, change who we buy from and what we buy. And part of that is standardizing our design in the areas that we build a lot. Our med-surg rooms now have a standard design. OR suites have a standard, trying to do the same thing with ED exam rooms right now. So I guess the question is, have you been able to balance, or have you tried to standardize those rooms or parts of your facilities and at the same time try to bring in that innovation, and how did you balance that?
Yeah, tell them about Garfield too.
Yeah, Kaiser's been all over the map on this. I mean, we've been to a very prescriptive, template everything, almost site adapt kind of facility, over to the Wild West, let's try everything new under the sun and see what happens. I'd say where we are today is somewhere in the middle. We do have templated room layouts and so forth based on best business practices and outcomes, evidence-based design. So we try to hang on to what few truths there are in all of this, but at the same token, how it's packaged, how it all interacts and how it operates as a living organism is still very much, I think, a variable that good design can influence heavily. So we're trying to take some of the shackles off and say, okay, somewhere, this big, medical architecture, healthcare architecture firm has worked with a client and has cracked a code on something, and boy, we would sure like to know about that. And the most disappointing thing I've ever heard is when an A&E says, well, we'd like to work with you guys, but you're not creative enough for us. We go, wait a minute, come back here, and so we're trying to change that conversation. It is a balance somewhere, and you never know exactly where the exact, sweet spot is. But, we're kind of big time right now because of this era of disruption where affordability is changing all the rules, to say, look, we're willing to take some risks that we weren't ready to take before. And we'll have a couple of boners out there that won't work very well. And, we'll have a couple of breakthrough things. Scott mentioned the Garfield Center. we have a platform in San Leandro, California, where we literally just try to use as an innovation center, and we try to bring in all different types of groups and so forth, and we'll mock up facilities, and we'll demonstrate technologies and do all those kinds of things, and it's really kind of just an opportunity for people to sort of think a little differently and see how we might approach some of these problems in different ways. So we've been able to get some good learnings out of that, and of course we try to dump those back into the process. It's an ongoing deal, and we need to keep investing in innovation, absolutely.
Here's a question right here.
Hi, Matt Steen from Novant Health.
Hi.
Your decision to obtain the LEED certification, was that, can you discuss how you arrived to pursue that? Was it from your consumer's request? Was it to make sure the building operation long term was where you want it to be? What drove that decision?
Yeah, I'd like to think there was some logical thought process to it, and you've outlined, you tried to give me a little help on that. But realistically, it was about, are we going to do the walk or are we going to do the talk? I mean, we keep talking about high-performing, sustainable facilities and all that, and we go, well, what are the metrics out there that would suggest that we're actually doing that? Oh, what do you know? There are actually metrics already established to do that. Of course, LEED isn't the only one, but, pick one and let's go. So we decided to go with LEED, and we kind of formed a strategic partnership with the Green Building Council and said, hey, if we do all of our buildings LEED, we get a discount, right, on plaques or something. So, big leveraging our buying power here. So, it really was it was more of an emotional moment than it was an analytical moment. Let's do it. We've been having the debate constantly. I was at VA. I saw Don Meyer back there somewhere. Hey, Don, how you doing? I was at VA. We were struggling about, do we want to pay for a plaque and all that kind of stuff. And you know what? If you go into a project that is going to be LEED Gold today, it's almost code, all right? So it's not that big a leap. And so, I just went up to literally our senior leadership and said, I got an idea, and unless otherwise directed, we're going to start doing this. And nobody argued too much, so we made it a policy, and now we're just doing everything minimum LEED Gold. And actually, I'm challenging all of our project executives to, why can't it be LEED Platinum? Why can't it be something beyond that? So that's the mindset that we have now. Everybody, ooh, there's initial cost associated with that. And you know what? Again, if you go into it with that mindset right off the bat, there really isn't any significant cost. In fact, when you think life cycle cost, it's a no-brainer because of the reduced cost and operations through the life of that building.
So Don, how do you deal with the dynamic with senior leadership? I see in a lot of systems where they say, we want to be disruptive, we want to be highly innovative, but we don't want to be the first ones to do it, which is almost kind of a self-canceling thing,
yeah.
But the desire for being different, but a desire not to be, to have it proven.
Let me give you a quick case study where we just had that moment, and that is we had a big off-site renewable project. We finally got this rock over the top of the hill. Our board of directors approved this project. When this project is completed, by 2017, Kaiser Permanente will have about 40% of its energy through green energy sources. Our carbon footprint reduction will be almost 40%, about 30% from what it was before. And this was a project that really didn't have any business driver behind it. It's really buying futures. It's making kind of, oh my God, the finances of this make your head explode. I mean, we had treasury guys and counsel all over this thing. And of course, it was all spring-loaded. Well, why would we want to do this? And who else has done this and all this? And we said, hey, go back to the slide, perform, grow, lead. This is a lead moment. You want to sit here and sharpen this marshmallow, or do you want to take a leadership role? And you know what? They bought it. All right? So we're going to do this project, and it's going to be so cool because, I mean, here is a case where we're investing in green power production that otherwise wouldn't exist. We're going to get all the environmental benefits and attributes of that, and we're going to be second in the country in green power production only to Walmart. And I apologize for any Walmart fans in here, but they're not in it for social good. They're in it for making money, all right? So that was how I was able to, hey, if Walmart's going down this path, they're in it for the bucks. There's a big business benefit to this. And of course, brand and go on and on and on. about the benefits of this, not to mention the fact that, it might be the greatest challenge of our time, to deal with this climate change issue. It was a no-brainer, but God, how do you get people to kind of, jump? So I think you just got to be kind of bold, put it out there, be willing to have a bunch of people call you a knucklehead, and eventually you get enough steam behind it and you roll the rock over the top of the hill. It was cool to do that. Again, Kaiser's got the scale that we can have a few all-heck moments, all right? That's what's cool about this business. It's kind of like being in venture capital, hey, I'll put a bunch of bets down and, ooh, what do you know, we got Google. So we're looking for Googles, all right?
Yeah. All right, we got time for like one or two more. Anybody else have a?
Yep, let me walk the microphone
we got
down.
some over there, okay.
Can you catch?
Terry Sauls with San Francisco General Hospital.
Hi, Terry.
Can you give us some words of advice on how you budget and plan for an ever-growing data infrastructure need? It seems to be like this monster that's insatiable, and when you talk about the San Diego hospital, it takes 10 years, and the California hospital, we're in the same situation where you start planning with a system that's got, as an example, the PoE, the power over Ethernet needs were 5 watts when you started planning, but now they're 65 watts as that whole thing changes.
Yeah, the infrastructure requirements for these facilities now for IT infrastructure is amazing. And believe it or not, 5 years ago we were debating whether to put wireless in medical offices or not. And now it's like, you can't even imagine we were having that conversation. From big Kaiser perspective, we were building, everything going digital imaging and all this kind of, the data needs were just going off the chart. The demand curve for data storage was going like this, and we couldn't keep up with the capacity in our data centers. And then all of a sudden we kind of went, wait a minute, there's this thing called the cloud. So maybe we don't need to build our own data centers, and so we're effectively getting out of data storage mode now. And there's a lot of privacy and security issues around all of this, of course, and that's all being dealt with very seriously. But it was the recognition that we can't. That's not a core business. We can't do that. But the demand for data and information has never been greater. It is the age of that. Everybody's got a smartphone, everybody's got the internet, and everybody has access to the cloud. Everybody in here has access to all the data in the world that they would ever need, and a lot more. So that has happened in a short period of time. Sometimes I think we're an information company as opposed to a healthcare delivery system, because it really is all about big data now. The electronic health record with 10 million people in the Kaiser community, gives us an incredible amount of data to work with in terms of research and find correlations in different events and healthcare outcomes and so forth. So we're really trying to leverage that, not just see it as a negative, but kind of see it as a positive. But from a facilities challenge, yeah, it changes the whole thing. I remember in the old day, IT was that conduit that somebody put on the wall after the building was opened, and everybody go, where'd that come from? Now it's a completely integrated part of the building system, and really the lifeblood in many respects. And that reimagining ambulatory design initiative that I alluded to earlier, it's all about technology. It's about how you leverage technology in new and better ways, to reduce the built environment, the footprint, the capital expenditure, and make it much more consumer focused for people that don't want to travel to healthcare facilities. They want to get healthcare wherever they live and work.
Michael, do we have time for one more?
Yeah, we have time for one more question right here.
Milo Mattox, Spectrum Health.
Hi.
I was just curious if you incorporate lean principles into your design, and if you do, when do you feel the best time to utilize that?
Lead, I'm sorry? Yes.
Lean.
Oh, lean, excuse me. Yes, absolutely. Going through, how do you get faster, better, cheaper? It's all about, the process. It's all about how you go about approaching the problem. And so I wouldn't say by any stretch, Kaiser is a leader in lean process work and so forth. I see many other systems that are more sophisticated than us, but we certainly see the value in it. And right now, every process that we have is challenged. You know, why are we doing these things? What we found in the past, of course, is we put global fixes on isolated problems, and before you know it, the controls start to balloon, and you know, everything starts to bog down. So we're taking this affordability opportunity as a license to steal, and we're kind of running around all of that control stuff that was put out there for all good reasons in the past and say, is there a lean process that gets you the same level of risk management without all the BS that goes along with all these layers of controls? And we're finding we're being pretty successful in that. If anybody is a lean expert and say, hey, I need to find a new client to work with, talk to me, because I think that we can raise our sophistication in how we apply lean principles to the process work we're doing.
Okay. And so I just want to reiterate something that Michael said earlier, that slides are going to be available, in a PDF for download, but if you want to see me after the break and give me your card, I'll make sure you get a copy of this as well, if that's of interest. So,
yeah,
Michael?
And I want to thank you guys, because I did see a few hands also rising up, so I know there are a few more questions. Don, you're here up until about the lunch hour, you said?
Through about 2:30.
Okay, so you'll be available for additional questions.
I'll be around next
I'd like to thank you guys so much, and Scott, you're here for the full event too?
I am.
Okay, excellent. Well, thank you guys.
Thanks, everyone.